In the past week, vaping has made headlines. Some people claim vapes or e-cigarettes are a healthier alternative to smoking. But the Indian government describes it as an epidemic among young people and has banned vapes completely. The move has stirred a debate as traditional tobacco products are still legal here. So we are asking, would a vape ban work?
See, the problem with smoking is that it is a stress buster.
And you started quite young, didn't you?
Yeah, I started when I was in class 4, about 8 years old.
8 years?
Yeah, that was my first BD. It was my cousins. They were in class 10.
Which is an Indian cigarette, but you actually were impressed with all the advertisements around that time for cigarettes for a particular private brand which said it's very macho to smoke.
Yes, but I was 8 years old. But definitely I knew, this is what a man does. A man eats meat and a man smokes.
But isn't it the same now? Because a lot of brands, especially these 400 odd brands which are being there in the market for vaping, they are now under scrutiny, especially in countries like the US, for showing advertising, which is targeting teenagers.
No, I don't believe it's targeting teenagers. It's just targeting the general population.
But Kanav, you tell me, what is it that makes it so popular?
Because it works.
You say it works. Is it also a fad for a lot of people because there are flavors?
You start vaping to quit smoking, right? But when you're vaping, everybody has a different taste. What appeals to me might not appeal to somebody else. So that's why we have flavors. But flavors is not what drives us towards it.
Dr. Ritu, now there are states in the US. New York has recently banned flavored e-cigarettes except nicotine and menthol. Michigan has taken a similar step. Is there a research which shows that, yes, flavored e-cigarettes is actually attracting the teenagers? And also, is it addictive?
It is. So yes, you're right. There's such a huge variety of flavoring agents which are being used. And I think they are definitely appealing to the younger generation. Apart from the fact that, that there is peer pressure, apart from the fact that initial cost being higher, the cost of the e-cigarettes over a period of time is much lesser than the normal cigarettes. Kanav is one section of society who is trying to quit from smoking to coming down to vaping. But we are also talking about one section of society who have not smoked at all. And they're taking to e-cigarettes only because they feel that it is not as harmful as smoking. And these e-cigarettes are showing ill health effects, as has been seen in so many researches and so many studies coming up in the US.
And when we talk about teen vaping, as I said, it's absolutely correct. Flavoring is definitely, taste is the most addictive in all of the sensory systems in the body. So definitely there is an addiction. And again, the problem is that for smokers who actually want to quit, that is the largest section of society.
Okay, I'm getting this comments from both of them. And Dr. Ritu, this is perhaps directed to you now, because both of them have said this is an alternative to smoking. A lot of people feel that, but isn't there any other alternative?
There are definitely alternatives which have been there for a long period of time. There are alternatives that have been approved by the FDA because they have definitely been considered safe now. There are also some prescription medications that psychiatrists and people like us prescribe to people who want to quit smoking. There is a drug called bupropion, which is actually an antidepressant, but has helped.
So there are medicines available. Alok, why didn't you opt for them instead of going for vaping?
It doesn't work.
You tried them?
Pre-period, I didn't try, but I know many people who've tried. Now, here's the thing. As I told you, there is an oral fixation. How do these drugs take care of those oral fixation where your hand, your eyes and your mouth are doing something? That is something that you only get in a vape.
Was I supposed to take antidepressants before I
But that depends again on the medical supervision as well. Of course, these are medical supervision questions. But I want to ask you something, Dr. Ritu, because you mentioned about the study. The Public Health England recently assured people in a study again that if you're talking about e-cigarettes, then 95% is safer.
Yeah.
It's actually 95% safer than smoking. UK scientists and campaigners are also focused on e-cigarettes as a way for adults to quit smoking. But the other part of that is is vaping deadly? Because we've seen there have been cases in the US specifically where at least 8 people have been found dead.
Absolutely, you're saying it yourself. So these are patients who have, they are young, healthy, with no sort of underlying illnesses at that point of time. We are talking of patients who have been as young as 18 years of age.
We as consumers and vendors have been pushing the government, please regulate. We cannot do self-regulation so much. Nobody's going to,
So now that it is banned, Kanav, what is the option for you? Would you look for a product in a black market or would you go back to smoking?
No, I am one of those people who'd be more careful about going to the black market. I'd unfortunately have to go back to smoking cigarettes.
Isn't the regulation then better here? Because if you look at India's policy at the moment, you actually have pictures on the cigarette packs which show lung cancer graphically. There are warnings which are in bold. Every time you see a scene in a television or a film, there are warning signs there as well. Why couldn't they do something like this for e-cigarettes? Won't that actually help people decide and make a better choice?
So again, if we look at the regulation that you're talking about on cigarettes, how much of that is in implementation really? I mean, there are there are still minors who are smoking despite the regulation by the government. The same could hold for e-cigarettes as well.
Okay.
Now, I am not denying the fact that regulation, very strict regulation, needs to be in place, and that is a good alternative for patients who definitely require it as a positive for their health impact. But given the completely unregulated market at this point of time.
So this is why the stringent step. But Alok, I want to ask you this. A lot of tobacco companies also have stake in e-cigarette business. A lot of them, including Indian manufacturers, started experimenting with vaping once they saw the popularity of vaping increasing. Tell me one thing. Has there been a pressure from the tobacco companies in your business as well when it comes to distribution, when it comes to reaching out to your customers?
That's the elephant in the room. No, not at all. Because, see, there has been a decline since the last maybe 10 years naturally from smoking. So these companies know that this is not going to last. And with vaping coming in, that has accelerated even further. The UK, France, Russia, United States, accelerated rates of, smoking going down.
But let me also ask you this, Kanav. Given a regulation, do you think you would regulate your use of vapes?
I've been regulating myself anyways. I've been constantly declining the amount I use of vape in the last 5 years. It happened naturally.
And naturally, yeah.
Okay.
And if I'm given a set of rules, it will be very easy for me to follow today. As a matter of fact, like I said, I think I panic purchased after the ban. I didn't need so much.
If somebody is in a position who is right now struggling with withdrawal symptoms after vape, and somebody like Kanav right now also said in the start of the show, I feel like going back to smoking. What is your advice to them at the moment?
Awareness in the children, awareness in young people of the very, very harmful effects of smoke as well as e-cigarettes.
Okay.
Awareness by physicians to their patients.
So awareness is the key. Thank you so much. Thank you so much for joining me. It's been clearly an educational edition of Work Life India. Thank you for being with us. And let me say, everybody has a right to choice, but a choice to healthy life is in your hands. Thank you for joining us.